Hello, I'm Dr. Patrick Hu, CEO of Moffitt Cancer Center. Really happy to come to you today from ASCO 2023 with Dr. Roger Lee, expert in bladder cancer at Moffitt Cancer Center. So, Dr. Lee, thanks so much for being with us today.
Thanks for having me so much, Dr. Hu. So here at ASCO, a lot of exciting new findings that are being reported in bladder cancer. Enfortumab vedotin, or an antibody drug conjugate that targets Nectin-4 with an MMAE payload, has really shown a lot of synergism with pembrolizumab. And it has recently been approved in the cisplatin ineligible patients for metastatic bladder cancer, urothelial cancer patients. And as a result, the field is really looking to see how to implement that combination strategy earlier on in the disease journey. And so there was a presentation made in the neoadjuvant setting looking at pathologic complete response, where they found a complete response of about 35% in cisplatin ineligible patients with muscle invasive bladder cancer. And then also they're formulating this into a intravesical infusion, so injecting it directly into the bladder to combat BCG unresponsive disease, also showing really good preliminary findings. We had a poster here at ASCO 23 in which we looked at a very rare variant of bladder cancer, the plasmacytoid bladder cancer patients. Partnering up with our partners at Foundation Medicine, we looked at about 270 patients with CDH1 mutations. And before, it was thought that as long as you have CDH1 mutation, you're bound to have plasmacytoid histology. And we actually found that that wasn't the case. So we found about a 68% occurrence of plasmacytoid in these patients. And as you would expect, they did have a completely different genomic landscape than the conventional urothelial cancer disease. So we're very excited about those results, and hopefully we'll be able to implement that into the treatment for these patients as well.
Wonderful. So it sounds like a lot of progress with bladder cancer. Do you think it's all going to help decrease cystectomies and try to have more bladder sparing?
That's absolutely what we're after. So we're trying to understand how to better treat these patients, but at the same time also trying to monitor within their bladder for disease recurrence, such that it is safe for us to continue to watch these patients with their bladders in situ and help them save their bladders.
Right, so in the future we'll have even better outcomes and less toxicity.
That's exactly right.
Wonderful. Well, thank you, Dr. Roger Lee, bladder cancer expert at Moffitt Cancer Center. Really appreciate you being here today.
Thanks so much.